Good morning, Dr. Barinja and everyone. This is Hussam Ibrahim. I'm using my wife's laptop. That's why it's showing the name here, Cornelia Stallings Ibrahim. I'm going to start sharing my screen with you all. So we can go ahead and start on the topic that I picked. The topic I picked is eczema or atopic dermatitis. Okay, eczema or atopic dermatitis. Atopic is coming from top because basically eczema happens on the skin, from outside part on the skin of it. Derma, refers to skin. So eczema dermatitis is, atopic dermatitis is the eczema. It's an itchy inflammation of the skin. Basically, the skin becomes bigger, inflamed, with redness, it becomes red. And it usually develops in early childhood. It might last when getting older. So basically, you most likely you see it among children. It's also more common among people who have family history with the condition, because we will know later on that this is a genetic disease. It happens to people who have certain family members, like the ancestors, the parents, who have that disease. If you look at the signs or symptoms, we'll see a rash that typically appears, for me, I put appears twice, anywhere on the body, anywhere on the skin, especially on the arms and behind the knees. We'll find some other signs or symptoms like dryness, flakiness, bumps, fissures, redness. All of these are symbols that, symptoms that show that the person has most likely eczema or atopic dermatitis. If we look here, move this here. If we look at the treatment and prognosis or complications, since this is a genetic disease, still there is no certain cure for it. But self-care should help to reduce the pain or to calm the itchiness down. Basically, what we are doing in treatment is we work on lowering the level of the itchiness and redness, flakiness, and all of this. We can do the following. We can moisturize the skin, like lotion or cream, 2 times a day. We can apply an anti-itch cream to the affected area to stop the itching. We can take an oral allergy or anti-itch medication to treat the allergy. Of course, do not scratch it, because scratching it is going to make it worse and worse. So the person with eczema should never scratch where it is, the area of the eczema. Applying bandages, especially the bandages which have like cream or lotion in it, not just a plain bandage. No, a bandage with the cream or a lotion is gonna, on the area where the eczema is, it should help a lot. Taking a warm bath as well, and choosing mild soaps without dye or perfumes, because basically perfumes, you put perfume on the skin. So if the skin has eczema, basically you are irritating the skin. So basically you're irritating the eczema. Next. I think we have like a technical issue here. Okay. If we look at pathophysiology or etiology, we'll find that eczema is caused by a combination of immune system. Basically, as we just said, It's a genetic disease. So it's related to the immune system, which comes basically from the parents and the ancestors. It also gets affected by environmental triggers and stress. Uh, if a person with eczema goes to area where it's very hot or with a certain environmental conditions, this triggers the eczema. It triggers the skin, and in this case, it triggers the eczema. Also, stress. You'll find some people who are psychologically stressed, their eczema might act up if they get stressed. Once they get stressed, their eczema might act up. I know some people who are literally like have eczema, and once they get stressed up, it's like they start scratching their hands, their foot, and so on. If we look at the epidemiology, we'll find the statistics of the disease. We'll find 31.6 million Americans are estimated to have symptoms of eczema. That's including 17.8 million with symptoms of atopic dermatitis. Worldwide, about 20% of the children and up to 3% of the adult population have some form or some kind of eczema. So basically, these are the statistics worldwide and in the United States of America. If we look at the physical examination, the test is what we do to make sure that the person has eczema. Primary findings of ED include, ED is atopic dermatitis, include xerosis, okay, lichenification and eczematous lesions. Those are like modifiers that tell us the person have eczema. Of course, I need to do more research on these, but this is just a beginner presentation. Exudations and crusting are common, and some patients exhibit prurigine nodularis-like lesions. The eczematous changes and its morphology are seen in different locations depending on the age of the patient. Of course, all of this is done by the doctor, so it can help the doctor determine that this is eczema or some other kind of other diseases that look like eczema. Next one is differential diagnosis, the one we just talked about, like how to differentiate between whether this is eczema or some other type of other diseases that look almost the same like the eczema. And because the skin lesions in atopic dermatitis can take many forms, papules, vesicles, plaques, nodules, and exfoliations, the differential diagnosis of atopic dermatitis is extensive. Conditions that need to be considered in patients with pruritus include seborrheic dermatitis, psoriasis, and neurodermatitis. So basically, these are like close to the eczema disease. Workup and tests. Basically, no lab test is needed to identify atopic dermatitis. Doctors will likely make a diagnosis by just examining the surface of the skin, outside the skin, and reviewing the medical history of the patient to see if some of the parents or the ancestors are having these diseases. So basically, they can tell, as we said earlier, this is a genetic disease, so he can be sure if this is eczema or not. He or she may also use patch testing or other tests to rule out other skin diseases or identify conditions that accompany the eczema. And eventually, these are just the references we used. And I do thank you so much for your time and for watching. And I really appreciate your patience with us, Dr. Barringer, and thank you for watching. You will have a good day. Bye.